Hello. I'm going to get started. It's 2 minutes after, and I don't want to hold up those of you who have joined on time. So thank you for joining us today for evaluating information during COVID-19, preprints, retractions, politics, rumors, and more. I'm Erica Brody, and I'm here with my colleague, Hillary Miller. We're librarians at VCU Libraries. This presentation is being recorded, and the slides, transcript, and recording will be available at guides.library.vcu.edu/AYR. So as you all know, we've been enduring the pandemic of COVID-19 since earlier this year. The pandemic continues because there's not yet a vaccine to prevent infection, nor a cure for those who become seriously ill. Scientific research to learn more about COVID is being conducted by many people around the world at an unprecedented pace. Unprecedented in terms of how quickly research is happening. As a result, the pandemic has produced what the World Health Organization calls an infodemic, an overabundance of information, some accurate and some not. That makes it hard for people to find trustworthy sources and reliable guidance when they need it. This graphic shows the overwhelming volume of scientific literature being produced. And this shows just those studies added to the database PubMed each week, about 2,000 articles a week for a total of over 50,000 PubMed entries just about COVID-19 since January of this year. During the next 40 minutes, we're going to discuss the quickly shifting landscape of information during the COVID-19 pandemic. We'll start with a description of the types of information that are out there. While there is a lot of research being published in scientific journals, there are even larger volumes of other types of information. Then, to illustrate the rewards and pitfalls of different types and sources of information, we're going to review the progression of information about hydroxychloroquine, a drug proposed to treat and/or prevent COVID-19. And we'll conclude with a discussion of the consequences of the hydroxychloroquine information explosion. So we want to take a minute to hear from you, just doing a single poll. What do you think of hydroxychloroquine? We have 4 options for you to choose from. I don't think hydroxychloroquine is an effective treatment for COVID-19. I think it might be effective. I think it's been proven effective, or you just have no idea. So I'll give it a minute. We just have one more person to respond. So it does seem like 2/3 of us don't believe hydroxychloroquine is an effective treatment. Some people think it might be, and one person has no idea. So that's interesting, and we'll see how you feel at the end of the webinar. We're talking about COVID-19 information because it can have a significant impact on you. This information impacts the treatments that healthcare providers offer you. It impacts the public health policies that may be put in place in your city or state, like requirements for wearing masks or other things. The information you get likely impacts your individual behavior, choices you make to avoid getting COVID-19, or information you share with friends and family in the hopes of influencing their behavior around COVID. Related to your research, you might be struggling with questions about which information to cite in your papers, or decisions on what research you should conduct to inform prevention and treatment of COVID-19. So we will start with the types of research communication that we're going to focus on today. So many of you are likely familiar with journal articles. They contain descriptions of research methods and findings that have typically been peer-reviewed. That means they've been read by experts in the field to ensure the validity and accuracy of the study. And as some of you may have experienced, this process of manuscripts submission, peer review, etc., can take a long time, usually several months to a year between the submission of the original manuscript and the formatted publication. This snail's pace doesn't work so well when information is needed quickly, like during the past spring when doctors just didn't know what to do for the patients with COVID-19, and they had a lot of these patients. So they couldn't wait for journal articles to be published at their typical pace. So during this time, peer review process was speeding up. Reviewers were faced with much shorter deadlines than usual. And with so many studies being done on COVID-19, the peer review system was hitting its capacity. Former editor-in-chief of the New England Journal of Medicine noted, "There's always a tension between getting it fast and getting it right. I always favored getting it right, but in the current pandemic, that balance may have shifted too far toward getting it fast." It's also interesting to see that the volume and type of information being generated about COVID-19 is actually quite different from the H1N1 pandemic that happened 11 years ago in 2009. In the first 3 months of H1N1, only 223 articles were published. During the first 3 months of COVID-19, there were 5 times as many articles published. Even more interesting, the type of research published during the first 3 months of H1N1 was different than that for COVID-19. 80% of the H1N1 studies, that's 4 out of every 5, was primary research based on a unique study generating new information. In contrast, only half of the COVID-19 studies published during the first 3 months of the pandemic described findings from primary research. The rest were syntheses, summaries of primary research. So it was generating a churning of existing information rather than new information. So syntheses of research can be great. In fact, we often think of them as some of the highest quality evidence we have. When they are done well, when they are true systematic reviews, with several people involved in reviewing the literature, when a comprehensive search of multiple databases is conducted to get all the evidence available, and when the study quality is assessed methodically, the systematic review can be very high quality, but this also takes a lot of time. But when you take shortcuts to save time, you're really conducting a rapid review. Maybe only one person reviews the evidence, maybe they only search just one database, and they might just skip the quality review of the studies. And with these shortcuts, you introduce the possibility of bias. And these rapid reviews provide lower quality evidence. Another topic related to published research that we don't always talk about is retractions. While published research can seem like the absolute truth, there are times when the authors or journal editors of a study determine that the research was significantly flawed and should no longer be part of the scientific record, and the study is retracted. Important to note, the study doesn't actually get removed from the scientific record, but it gets a big red warning mark on it, which readers should interpret as, "This is wrong." So the next type of research communication we're going to talk about is preprints. Preprints are research papers that haven't yet been formally peer-reviewed by a journal. Researchers sometimes share preprints alongside the submission of the paper to a journal as a way to disseminate their findings more quickly, which can be important during a pandemic when people are getting sick and some of them are dying. Preprints can also be used to disseminate negative results that may be more difficult to publish. So these are important in a pandemic when we need to know what doesn't work to prevent or treat the disease, as much as we need to know which treatments are effective. Another benefit is the opportunity to get earlier and wider peer review if authors use preprint feedback to make revisions before or during journal peer review. And you might be wondering, are publishers okay with authors sharing papers online before they've been reviewed? And with having these preprints available online alongside the published version, many publishers do accept submissions that have been shared as preprints, but this also comes with requirements. They have policies about which platforms authors can share on, or a requirement that authors add a link pointing to the final published version. So if you're thinking of sharing a preprint, you should always make sure to check the policies of any journals you're considering submitting the article to make sure they accept preprints and confirm what requirements or restrictions they have for sharing. There are around 70 platforms branding themselves as preprint services across all kinds of disciplines. You can see a lot of similarity in their names because many are named after Archive, a preprint platform for physics, math, and computer science that was started 30 years ago. PubMed Central, a major research database from the National Institutes of Health, also began a pilot in June to add preprints specifically related to COVID-19 to its platform. So this means you're going to see preprints in PubMed. So preprints are becoming fairly common as a way to communicate research findings faster and gather feedback, and you're likely to come across them in your research. However, sharing preprints isn't without drawbacks and risks. As with all research articles, a single preprint isn't enough to form evidence-based decisions. It's only one piece of evidence, and one that hasn't yet been through the formal peer review process. This is especially important to keep in mind as evidence grows that preprints can drive public discourse as they're shared and discussed through news coverage and social media, especially during a global pandemic where everyone is seeking the latest information and looking for treatments and cures. It's always important for those reading research articles to assess study design and quality, the potential for bias, and study limitations. Because preprints haven't yet been through the formal peer review, this kind of close assessment is especially important. Preprint platforms are also at risk of being taken advantage of by those who might deliberately share papers that have inaccurate, misleading, or false information, or those who just want to stir the pot. Some preprint platforms are taking new steps to mitigate these kinds of drawbacks. When the health sciences preprint platform medRxiv was founded in 2019, they recognized that there were higher stakes for posting non-peer-reviewed medical research than there might be for other kinds of research. So they put more stringent screening processes in place than other preprint platforms. medRxiv's screening process has even been described as peer review by another name. The screening process is mainly used to identify articles that might cause harm rather than to actually evaluate quality. So like papers that contradict well-established knowledge, for example, a paper that claims smoking doesn't cause cancer, or papers that might fuel conspiracy theories. Our last two sources of research information move us away from the realm of research literature to mass media and social media. We have our traditional mass media sources, newspapers, magazines, television, radio. These offer interpretations of current events by journalists. These media channels are competing for readers and their subscription dollars. So they take a complex research study and boil it down to a sexy headline like COVID-19 miracle cure. Many people won't read the actual article, and far fewer people will take the time to go to the original study published in a peer-reviewed journal, and even fewer may have the skills to critically assess the quality of the study. People reading the headlines might just run to their doctors demanding miracle treatments. In the last 10 years, we've seen a lot of new, emerging sources of information. Our news now comes from blogs, online-only publications like medium.com or axios.com, also the online presence of traditional media. We also have things like TED Talks and YouTube. So some of these emerging sources bleed into our next category of information, social media, which includes platforms like Facebook and Twitter. And these platforms can be used by anyone to share information. They're open to anyone, so they're often used to share rumors, unsubstantiated information, and disinformation, a term that specifically refers to information that is meant to deceive. This means that information that is vetted and shared by experts or other reliable sources, including well peer-reviewed research, is competing for attention and trust in these spaces. So to look at how these various methods of research communication have played out in the context of the current COVID-19 pandemic and infodemic, and how they've impacted decision-making, we're going to focus on what has happened and is still happening with the drug hydroxychloroquine, along with its cousin drug, chloroquine. So I'm going to pass this back to my colleague, Hillary.
So now we're going to walk through a timeline of some of the events around hydroxychloroquine and the debate surrounding its use as a treatment for COVID-19. Why did it achieve so much public attention? Who proposed it as a treatment for COVID-19, and who further promoted it? Why has there been so much debate, and what impacts has all of this had? So first, I want to take a second to review the evidence-based or proven benefits of the drugs hydroxychloroquine and its cousin drug, chloroquine. Both drugs are used to treat and prevent malaria, and hydroxychloroquine is also used to treat autoimmune conditions, including lupus and rheumatoid arthritis. So in the first phase of the timeline, the buzz around hydroxychloroquine begins to grow. In late January, online discussion began in China about the potential for hydroxychloroquine and chloroquine to treat COVID-19. And in February, the discussion expanded to Nigeria, France, and Vietnam. And then on February 4th, a letter was published in the high-profile, widely read journal Nature from researchers at 2 Chinese institutions. The letter described study findings that indicated chloroquine might inhibit the replication of the virus that causes COVID-19. These findings were based on an in vitro study, meaning it was performed in a lab, not with human patients. And the researchers concluded that chloroquine should be assessed in human patients who have COVID-19. However, they were not yet advocating for widespread use in patients. So on February 28th, Didier Rao posted a YouTube video about the benefits of chloroquine for treating COVID-19 based on research in China. To understand why Rao and his claims got so much attention, it's important to understand who he is. Rao is a microbiologist in France who founded and runs an institute dedicated to fighting infectious diseases around the world. Even before COVID-19, Rao was well known, partly due to his high rates of publishing and citation. So in other words, he was a sort of science celebrity who had a level of notoriety that made people pay attention to his claims. And on March 20th, the main event, as far as our story is concerned, happened. Didier Rao and his research team shared a paper reporting on their study of hydroxychloroquine as a COVID-19 treatment. They shared a preprint through medRxiv, and the formally published article was published in the International Journal of Antimicrobial Agents. The article received a lot of immediate attention, especially because Rao had allowed the article to be posted a few days earlier on Twitter by others who were hyping hydroxychloroquine through news and social media channels. But when researchers looked more closely, they raised a number of concerns, including a study design that non-randomly assigned patients to the treatment and control groups, as well as errors and discrepancies throughout the paper. The article reported on a very small trial that was scheduled to run for 2 weeks, but Rao thought the results were promising enough after just 6 days, so he decided to end the trial early and publish the results. Only 20 patients were included in the paper's final results, although others had participated in the trial, but had stopped treatment with hydroxychloroquine before the trial was ended. This included a patient who developed nausea, patients who were transferred to intensive care, and even a patient who died. And in spite of these issues, within days, Rao's study was promoted by Dr. Oz on his Instagram account and in an interview on Fox News, and it was also promoted by President Trump on Twitter, all of which led to an even greater amount of attention from the public. So this is when the conversation really started to get messy. there was constant debate about the benefits and risks of using hydroxychloroquine. Papers were published and then retracted. Policy decisions were influenced by as of yet unproven research claims. And one of these policy decisions occurred on March 28th, when the US Food and Drug Administration issued an emergency use authorization for hydroxychloroquine for patients hospitalized with COVID-19. This allowed the FDA to permit healthcare professionals to use the drug for off-label, not yet FDA-approved uses. And as a result, it also diverted the drug away from its normal uses and created the potential for shortages. Within about a week of the FDA's order, the president discussed the drugs at multiple news conferences, raising the public's hope of a promising treatment. And on April 3rd, 2 weeks after the Rouse article was published, we started to see formal concerns about the article when the International Society of Antimicrobial Chemotherapy, or ISAC, who co-owns the journal along with the publisher Elsevier, issued a statement of concern about Rouse' article. They said, the ISAC board believes the article does not meet the society's expected standard, especially relating to the lack of better explanations of the inclusion criteria and the triage of patients to ensure patient safety. However, the journal didn't retract the article. A week later, ISAC and Elsevier issued a joint statement on the article, stating that they had commissioned a further review of it and that they had contacted the authors about addressing the concerns, but they still didn't retract it. So throughout May and June, more questionable and concerning preprints and articles related to COVID-19 were published and then retracted, including several related to hydroxychloroquine, which further fueled the debate. The publishing blog Retraction Watch has a list of retracted and withdrawn COVID-19 papers if you want to see more examples of these. So in the midst of this debate, on June 15th, 2 months after it was issued, the FDA revoked its emergency use authorization for hydroxychloroquine for 2 reasons. First, as more research about the drug was performed, the case for its effectiveness as a treatment became less compelling. Second, because of potential side effects of the drugs, the FDA felt the benefits of its use didn't outweigh the risks. So getting back to the Rao article, on July 8th, the authors responded to Elsevier in a public statement. And the response is difficult to summarize, but the link is in the final works cited slides, which will be shared. And Erica is putting it in the chat for you now if you want to take a closer look. A few days later, on July 13th, the journal commissioned review of the article was published in the journal where Rao's article originally appeared. And the review was completed by Frits Rosendahl, chair of the Department of Clinical Epidemiology at the Leiden University Medical Center in the Netherlands. And Rosendahl found that the paper suffers from major methodological shortcomings, which make it nearly, if not completely, uninformative. He also stated that it was fully irresponsible to recommend use of hydroxychloroquine on the basis of such questionable research, especially when people are desperate for treatments and there are potentially serious side effects from taking the drug. And then Rosendahl concluded, this is a non-informative manuscript with gross methodological shortcomings. The results do not justify the far-reaching conclusions about the efficacy of hydroxychloroquine in COVID-19. And in the view of this reviewer, do not justify any conclusion at all. With all this, you might expect that the journal finally decided to retract the article at that time, but they didn't. On the same day the commissioned review was published, ISAC senior officers also published an editorial explaining why they chose not to retract the article in spite of the findings. We believe, in addition to the importance of sharing observational data at the height of a pandemic, a robust public scientific debate about the paper's findings in an open and transparent fashion should be made available. The takeaway here is that even though an article has been peer-reviewed and published in a journal, it's always vital to do your own assessment and see how others are citing and responding to the research before making treatment decisions based on its claims. So you might be thinking, after all this, we're getting closer to consensus about hydroxychloroquine, even if the consensus is something like more research is needed or benefits may not outweigh the risks for many patients. However, as the last step in our timeline, on July 28th, President Trump distributed videos touting the benefits of hydroxychloroquine in the fight against COVID. This was over 1 month after the FDA retracted its emergency use authorization, again, stating the effectiveness was not conclusive and potential benefits didn't outweigh the known and potential risks. The videos shared included a video from a group calling themselves America's Frontline Doctors that was viewed millions of times and shared through Facebook groups dedicated to anti-vaccination and conspiracy theories. Doctors have reported patients who have demanded prescriptions for hydroxychloroquine based on claims from social media. This video and the massive viewing and sharing of it caused an uptick in these kinds of patient requests. So this brings us to the consequences of the hydroxychloroquine case. Patient demand for hydroxychloroquine is one example of the serious risks and consequences of social media and mass media hype about hydroxychloroquine. Patients were demanding access to the drug, and doctors were using it in the spring since they didn't have other treatments to offer in some cases, even though the question of its effectiveness was still under debate. So this information, as well as policy decisions based on this information, led to shortages of the drug. This made it harder for people with lupus to access it, and hydroxychloroquine is a drug that has been proven to help people with lupus. Hydroxychloroquine also caused some patients harm, including heart problems like arrhythmia. Some people even confused hydroxychloroquine with other similar sounding but different drugs, including a man in Arizona who died after taking chloroquine phosphate, which is used to clean fish tanks. Another consequence of this hype about hydroxychloroquine relates to research priorities. So on April 24th, there were over 100 trials about hydroxychloroquine going on, and many people were volunteering for the trials of hydroxychloroquine rather than for other drugs, which has derailed clinical trials of other treatments in some cases. And all of these risks have been exacerbated by sharing and publishing of questionable research, which has led to confusion about what the experts recommend and even who qualifies as an expert. And some people have spread disinformation, intentionally deceitful or misleading information about hydroxychloroquine based on research that has been called into question, discredited, or even retracted from journals in some cases. So with all of this very quickly shifting information about hydroxychloroquine, we have a situation where we give people hope that this drug works or may work, and then we have to say, wait, we were wrong or we're not sure. This creates a distrust in science. And this can be very dangerous, for example, if and when a vaccine becomes available and people may not get the vaccine, if too few people get the vaccine. This limits our ability to create the herd immunity we need to stop the spread of the virus. One last troubling impact of this information landscape is that some researchers have been threatened. A researcher in Brazil whose clinical trial showed safety issues with high doses of chloroquine diphosphate received death threats from people who believed in the safety of the drug for about 2 weeks until the study was published. So this pandemic has really shown how the volume and the speed of information from so many sources can cause a lot of confusion and some pretty negative consequences. And now I'll pass it back to Erica to conclude.
Thanks, Hillary. So based on everything we've discussed about the case of hydroxychloroquine, we have some tips for navigating an infodemic within a pandemic. And you might have others you'd like to share during the time for questions and discussion. So never rely on one study, whether it's a preprint or a formally published article. When reading a research paper, always determine if and how it has been peer reviewed. If it hasn't been, give it additional scrutiny. And a researcher's expertise, so the author of the study, should be specific to the study. Otherwise, you should read with a healthy dose of skepticism. In the context of COVID-19, not just any doctor or science research has the expertise needed to research and publish on something like the use of hydroxychloroquine to treat the virus. Be wary of celebrity doctors. And it's important to consider what the authors say about the limitations of their study, their research, and what are they actually concluding or recommending. For example, are they concluding that hydroxychloroquine should be used in patients, or are they concluding that hydroxychloroquine should be studied in patients? And just to make sure that you have all of you have access to high quality information about COVID-19, I want to point you to the VC Library's research guide on the topic. And you can find this at guides.library.vcu.edu/disease-outbreaks/COVID-19. So hopefully we've met these learning objectives and you feel more ready to do the following. Navigate the quickly shifting landscape of information in a pandemic. Describe ways to approach the quality of information that is being produced and disseminated at a faster pace than ever seen before. And identify the limitations and cautions of relying on a single source of information for decisions. And now we have time for questions and discussion. Feel free to unmute yourself or to type questions or comments in the chat box. So does anyone want to share their experiences with finding and sharing information about COVID-19 with friends or family?
Most of the information that I've gotten from COVID-19 has been directly from my department. I work as an EMT, and so I get my information from my county fire department. And I was educating them about how to properly wear a mask, because I did not know that was not like common knowledge. And educated them on different types of masks that were currently available at the time. N95s were still being sold at Home Depot and Lowe's. And it was kind of funny to me how quickly just the regulations were changing of whether masks were efficient or not efficient, and that debate before even the treatments were debated.
Yeah, that makes total sense. I have a family member who was like, well, the scientists said the masks aren't, working, and then they changed their minds. So that's a perfect example, right, of where trust in the science is compromised.
And I actually think the entire, about mask wearing could have easily been the case study we looked at here, because some of the early information that was coming out is not, the later information that was coming out, and how much, maybe even more widespread than hydroxychloroquine, this very, very widespread debate on, how to or if you should use masks.
So Taylor posed a very interesting question in the chat box about what needs to occur to create trust again within science. I think that's a really hard question. I think that the COVID-19 pandemic has actually caused some people to be looking at the peer review system and questioning whether it needs to evolve a little, as it's not changed a lot in many years. So I'm not sure exactly what needs to be done. I think it will take a while.
Yeah, I think the peer review is one thing that is interesting. If you remember the quote from one of the editors, or actually I don't know if we included that, but some people in journal publishing have pointed out as almost a defense of these articles kind of slipping through the cracks in journals that, traditionally peer review wasn't really meant to root out fraud, outright fraud. It was sort of, meant to look at the quality of the article or the design. And I think that's interesting, because they sort of say, this is, the public is misunderstanding the purpose of peer review. But when I hear that, I kind of think maybe shouldn't peer review also be meant to root out fraud or, errors, even in research, unintentional errors, or come down even more strongly on research articles that don't do a good enough job of talking about the potential for bias, the limitations of the study. And I think that is probably maybe part of the biggest piece of education and communication that needs to happen from scientists, from research institutions, is always really, really hammering home whoever they're talking to, whether it's a journalist or anyone else. One research study, one article is never, ever enough evidence to base decisions on. And it's hard to control the messaging sometimes when it goes beyond your article and it gets picked up, online or social media. But yeah, I think that maybe that needs to be, the first disclaimer of every article is things this article should not be used for. Please don't make decisions based on this yet.
And interestingly, the study that compared the H1N1 information to the COVID-19 information, they pointed out that for the COVID-19 information, only 3.6% of the articles included any limitations, either in the abstract or at all. I'm not sure now. We read a lot of information to put this together, so some of it's blurring. So we have another interesting comment in the chat. Somebody suggested that other countries are also dealing with an infodemic, but wondering if the infodemics is bad in other countries as in the United States, because other countries seem to have been able to take on the pandemic more effectively, and they also have a smaller population compared to the US. That's definitely an interesting observation.
I was wondering if you have any tips about how to properly read a research article, because that's still kind of confusing to me.
Hillary, do you want to start or do you want me?
Yeah, you can start if you want.
I mean, I think unfortunately it takes a lot longer than any of us would want it to take. I mean, I think it's helpful to sort of start with the methods and results just to get the main gist of it, because I think sometimes when I start reading the background, I just sort of get lost and sometimes makes me fall asleep. But then as you read the results, making sure you look and see if you agree with the limitations the author has come up with, and maybe you've considered some of your own. You can also go online and see if other people have cited the article. That might suggest that other experts believe that it's credible. Or you can go online and see if other people have contested it or disagreed with the findings. One of the things we did not talk about today is there's a service called Cite AI. I think it's SCITE.ai, and they have an interesting new tool where you can download a little web browser. What's that called?
Oh, like an add-on.
An add-on, a plugin, and it will show you based on the information in their database, which is not every publisher, if people have agreed or cited or disagreed with the findings. The other link I'm working on finding right now is that the New York Times even published an article during all this about how to read a scientific article, because they realized that so many people were looking at science than they had before. So I just found that link. I'm putting that in the chat.
I think it's also a good time to plug for those of you who, if you haven't used it before, we have a database and resource called Sage Research Methods. So that may help you get some sort of factual background on methods of articles, or, which could hopefully help draw attention to, the types of risks or drawbacks inherent in each type of research. So, observational studies, for example, have a greater possibility for bias. It's more difficult to, draw conclusions about cause and effect, for example. And I think probably kind of trying to learn those things, hand in hand so that they immediately trigger in your mind, especially if you don't see someone talk about their own limitations. Well, this is this kind of study, and as I'm reading it, I'm going to know that I need to keep an eye out for these types of limitations or potential risks.
Also, sorry, there's some journals that are that publish like critical summaries of articles. I think the journal Evidence-Based Dentistry, I think ACP Journal Club, there's probably others, or I'm sure there are others. And so these are places where some research has been critically appraised by an expert, and you can review that.
And the last thing that I'll plug, we didn't go into this as much in depth, but similar to the cite.ai, which is actually like an AI tool to do this, evaluation of citations, there are a lot more emerging platforms that are dedicated to post-publication peer review. So you could think of it almost like a comment section on a blog or something, but they're meant for articles to be linked to and for people to draw out, in some cases, very thorough, very detailed critiques. As an example, if you go to medRxiv to see the paper published by Didier Rao, even on that platform, they have this kind of comment section, and that's one place where people were immediately raising concerns about the article in question. Erica dropped a link for PubPeer as well. This is just, yeah, exactly. The whole platform is dedicated to this kind of commenting. And its use is not, I wouldn't say super widespread among every researcher, every discipline, but it does seem to be something that's growing a lot, and I think will become much more common.
And I really do think reading and critiquing articles is a skill that takes a while to develop. So one other recommendation would be starting or joining a journal club where you read articles as a group, and maybe one of the people involved has more experience than, or some of the people have more experience than others, so you can get used to spotting the types of flaws that you might find in the research in your discipline.
Okay, well, I'm not seeing anything new in the chat. So with that, I think we can go ahead and wrap up a bit early, which is good in case anyone has meetings or other things going on right after this. I think just thank you for being here. And if you have any further questions, you can get in touch with us. There will be a recording of this, like Erica said, recording and transcript and slides. It is going to have a very long list of citations and suggested readings for all of this content here. And it may even be a little overwhelming because when she says we did a lot of reading, like this probably could have been 5 times as long as it was. As you all know, there's a lot going on right now. So thank you for, in the midst of all of this going on, being here today.
And if you don't mind filling out the evaluation link that you're going to get from the library, that really helps us know how to improve our programming going forward. Thanks again.
Thank you.